Hi, I'm Jared. I'm a pharmacist here at Strive Pharmacy, and today I'll show you how to properly use and store your sublingual dropper medication. Start by removing the cap from the vial. Unscrew the cap and insert the sublingual dropper fully into the self-sealing adapter on the bottle. Turn the vial upside down and gently pull back the plunger to draw up your prescribed dose. A good rule of thumb is that 20 drops is equal to 1 milliliter. But remember to always follow the exact dosing instructions provided by your prescriber. Once measured, turn the vial right side up and remove the dropper. Dispense the medication under your tongue by pressing the plunger down. Allow the medication to sit under your tongue for at least 90 seconds to allow for proper absorption. After 90 seconds, you can swallow the medication. Wait 15 minutes before eating or drinking to ensure optimal absorption. When you're finished, check to make sure the top of the glass bottle is clear. If needed, gently wipe it clean with a tissue or paper towel, then replace the cap securely. Wash the dropper with warm, soapy water and allow it to air dry completely. If the measurement markings on your dropper begin to fade, you may use one of the provided spare droppers. Once dry, replace the dropper cap. Store your medication in a cool, dry place away from direct sunlight, heat, and moisture. Remember to always keep it out of reach of children and pets. Thank you for joining us today. If you have any questions, please reach out to strivepharmacy.com.